Have you ever been in a situation where you're trying to master something really complex, maybe hands-on, like learning to drive or maybe a tricky new procedure at work,
Oh, yeah, absolutely.
and you've got an instructor right there watching every single move?
The pressure.
That pressure is just immense, isn't it? And the difference a really effective teacher can make in that exact moment is
Well,
it's huge, critical, really.
it really is.
So today we're doing a deep dive into exactly that. We're exploring how a clinic instructor can be a more effective teacher when they're guiding students who are actually treating patients.
Right. The stakes are incredibly high there.
Exactly. This isn't just about passing on knowledge. It's really about fostering actual skill, building up confidence, and creating a positive learning environment where patient care can actually thrive.
A safe space to learn, essentially, even under pressure.
Precisely. And we've gathered insights from some really fascinating sources. We've got research on dental hygiene faculty development, detailed communication protocols used right there in clinical practice, and even a big review looking at the impact of huddles in healthcare.
Some really solid stuff to dig into.
Yeah. Our mission here is basically to pull out the most important nuggets, the key takeaways, so you can understand what helps instructors truly excel in this, let's face it, incredibly challenging but also really rewarding role.
Definitely.
Okay, so effective teaching in these high-stakes clinical settings. My first thought usually jumps to, like, raw technical skill. Does the instructor know their stuff? But is that really the most important thing?
That's such a good question.
What does the research actually prioritize when it defines an effective clinical instructor? What makes them stand out?
Yeah, it's interesting because effectiveness, it really starts with a foundation of attributes that go way beyond just knowing the technical procedures. What's really striking isn't just what makes them effective, but how consistently the research points to, like, the human element. It's often valued even over just pure technical brilliance.
Oh, the human element.
Exactly. If you look at a study on dental hygiene education by Artem and colleagues, back in 2020, they used something called a Delphi research design.
Delphi, what's that exactly?
It's basically a method where experts systematically share and then refine their opinions over several rounds to reach a consensus. So they got 14 expert dental hygiene instructors from 13 different states.
Okay, so real experts weighing in.
Right. And they identified, get this, 91 characteristics of effective clinical teaching.
91. Wow, that's a lot.
It is a lot, but they really boil down to a few core insights.
Yeah, good. What are they?
So at its core, it's about really masterful communication and genuine human connection. An instructor needs to make expectations super clear, like impossible to misunderstand.
Right, no ambiguity.
None. And build relationships based on trust and create a clinic atmosphere where mutual respect isn't just, a poster on the wall. It's how everyone operates.
Makes sense.
And beyond that, they have to be powerful role models, showing strong personal character, being emotionally intelligent, genuinely caring, trustworthy, fair, honest, supportive.
So the whole package.
Pretty much. The research consistently shows students respond best when they feel the instructor genuinely cares about their growth as a person and a professional.
Yeah, I can see that.
And finally, these effective instructors, they excel at creating a really conducive learning environment, one that emphasizes collaboration, motivation, practical guidance, and this is key, constructive, positive, corrective feedback.
Positive feedback, even when correcting mistakes.
Exactly. It's about making it a psychologically safe space to learn, even when you mess up, setting the stage for growth, not just pointing out errors.
Okay, so it sounds like those soft skills are really just as crucial, maybe even more so, than the pure technical know-how.
They're definitely non-negotiable in this role.
But how do these, high-level qualities actually play out in the moment? Like, when you're right there, guiding a student through a delicate procedure on a real patient, it has to be practical, right?
Absolutely. The attributes are the foundation, like we said, but these communication protocols, they're the tools you use to actually build on that foundation day to day.
Okay, tools. I like that.
So drawing from Walter Bale's work on communication skills in clinical practice, there's this protocol called TIMER. It offers a really structured but still very human approach to communication during supervision.
TIMER. Okay, let's break that down. What's the T?
T stands for think through the encounter ahead of time. So instructors need to prepare, gather all the info they need about the student, the case, whatever it is.
Makes sense. Prep work.
But here's the interesting bit. They should mentally rehearse what they'll say, but actively avoid what Bale calls catastrophic thinking.
Catastrophic thinking, like imagining the worst possible outcome.
Exactly, dwelling on disaster. Instead, they should approach it with a feedback hat mindset, meaning their main goal is just to observe and identify areas for growth, not to judge or criticize.
Ah, okay. Focus on improvement, not blame.
Precisely. Then comes I, introduce issues. Ideally, you try to meet the student on their turf, if possible. Avoid that feeling of being summoned to the principal's office.
Yeah, that immediately puts you on defense.
Right. And issues should be stated clearly using I statements like I'm concerned about or I'm worried about, using objective facts, not personal opinions. And maintain good eye contact, show you're engaged.
Okay. I statements, facts, eye contact.
Got it. What's M? M is manage the discussion. This is where the instructor needs to stay calm, really listen without judgment, and focus on understanding the student's point of view.
Active listening.
Very active. Techniques like just saying, tell me more, can really help clarify things. And here's a fascinating one. The 6-second rule.
6 seconds. What's that?
So, when you feel that wave of frustration rising, maybe a student made the same mistake again.
Uh-huh.
That 6-second pause, it isn't just about not snapping. It's like giving your brain a beat to switch from pure reaction mode to a more thoughtful response mode. It allows for empathy.
Okay. Let the emotion pass before speaking.
Exactly. And during the discussion, reaffirm what the student says, maybe paraphrase it. Use empathetic statements like, I can see this is tough for you, or I know this isn't easy to hear. Even wish statements like, I wish things were different, can help acknowledge reality gently.
Okay. Empathy is key there. Then E.
E is establish a plan and expectations. Once things have calmed down emotionally, the goal is to work with the student on solutions. Collaboration.
Right, not just dictating.
No.
Yeah.
Clearly state the expectations like, okay, it's important we figure this out, brainstorm ideas together, and set SMART goals, specific, measurable, achievable, resourced, and timed.
SMART goals, classic.
Yep, and then summarize the plan so everyone's clear.
Okay. TIMER.
R is revisit and give feedback. This is crucial to follow up. Check in later. Ask the student, so how are things going with X?
Losing the loop.
Exactly.
Yeah.
Praise effort where it's due, give specific feedback on what still needs work, and brainstorm together again on how to improve further. And if things haven't changed, well, the protocol says state the problem clearly again, explore why progress isn't happening, manage any new emotions, restate the need for improvement, and, if necessary, outline potential consequences. It's supportive first, but holds accountability.
Wow, that TIMER protocol sounds incredibly thorough for those one-on-one feedback sessions. Really structured.
It provides a solid framework.
But clinics are busy places, right?
Yeah.
It's rarely just one instructor, one student in a vacuum. You've got teams, other instructors, students, staff.
Oh, definitely. Chaos is often the default state.
So how do entire teams stay aligned? How do they keep everyone on the same page? Especially with multiple patients, complex cases happening all at once.
Right. That's where we scale up from individual communication to team communication. And structured tools can make a massive difference here, too. Let's talk about huddles.
Huddles, like in sports.
Kind of, but quicker. We're drawing here from a big scoping review by Pimentel and colleagues from 2021, and also some practical advice from Heather Fior in 2024.
Okay, so what is a clinical huddle?
They're basically brief, really focused stand-up meetings, ideally like 10 to 15 minutes max.
Short and sweet.
Exactly. They're designed for quick, collaborative information sharing across the whole team, doctors, nurses, students, instructors, everyone involved. The key is that brevity and focus. They cut through the usual clinic noise.
And what's their main purpose?
Primarily, it's about engaging the team, improving communication, collaboration, coordination, all the C words.
Ah, right.
They also help flag urgent issues, update everyone on safety or quality concerns, and maybe plan for upcoming work or improvements.
Okay, so how does this actually help with instruction?
Think about it like this. Before a clinical session starts, the instructor and students could have a quick huddle. Review the day's schedule, maybe tricky patient histories, potential challenges.
So everyone's prepped.
Exactly. Fiore mentions this really streamlines everything, from the actual treatment right through to patient checkout. It's like a shared mental warm-up for the whole team.
I like that. A mental warm-up.
And keeping them short means you don't waste valuable clinic time. But crucially, everyone gets a chance to share updates, ask quick questions, suggest improvements. It builds teamwork and accountability.
Especially important for students learning to navigate complex stuff right.
Wow.
They can voice concerns early.
Precisely. And it fosters proactive problem solving. If there's a potential scheduling conflict or maybe an equipment issue, you address it before it blows up during patient care.
Preventative maintenance for workflow.
You got it. And it's not just about problems. Huddles can be great for morale, too. Imagine using the start-of-day huddle to quickly celebrate a small win. Like, hey, everyone, congrats to Sarah for mastering that new technique yesterday. Or sharing positive patient feedback.
Yeah, that could really boost the mood.
Totally. It lifts team spirit, gets everyone motivated. Then you end with a quick recap, maybe some encouraging words, reinforcing that shared goal. The Pimental Review, which looked at over 150 studies,
Wow.
found huddles consistently led to better efficiency, communication, situational awareness, and even higher staff satisfaction. For instructors, that translates directly into a more organized, safer, more supportive teaching environment.
Which ultimately benefits the students and the patients.
Win, win, win.
Okay, so structured communication, like these huddles, clearly builds a strong foundation for effective teaching. Benefits everyone involved.
Definitely lays the groundwork.
But what about the instructors themselves, especially the new ones, the novices? What kind of support do they need to actually be effective in this really demanding role?
That's such an important piece of the puzzle.
It feels like we focus a lot on the student learning, but who's looking after the teachers?
Yeah, that's a critical question. Because making that jump from being a practitioner to being a clinical instructor, it's a huge transition. It brings its own unique set of challenges.
I bet.
There's a study by Smethers and colleagues from 2018 that looked specifically at the experiences of novice dental hygiene faculty, and their findings really shine a light on what helps instructors become more effective.
Okay, what did they find? What are the big challenges?
Well, the surprising thing, maybe, is just how unprepared many new instructors felt. They talked about having low confidence, significant anxiety, especially when they had to teach material they weren't super familiar with themselves.
Imposter syndrome, maybe?
Sort of, yeah. And they also found the sheer workload, balancing teaching, other academic duties, prep time was often overwhelming. Much more than they expected coming from practice.
It's a different kind of demanding.
Totally. And interestingly, age seemed to play a role in the types of challenges they face.
Oh, how so?
Younger instructors, say in their 20s or early 30s, often struggled because students sometimes doubted their competence or saw them more like peers.
Making it hard to establish that instructor-student dynamic.
Exactly, which is vital, right?
Yeah.
But then older instructors, maybe 40 plus, they sometimes found it challenging to relearn specific course terminology that might have changed, or just getting up to speed with new technologies in the clinic or for teaching.
Different hurdles depending on experience level.
Right. But the good news is, the study also identified strategies that really helped these novice faculty, things that ultimately made them more effective instructors.
Okay, what worked? What helps them succeed?
One of the biggest things was mentoring and shadowing. Having experienced instructors they could observe, follow around, ask questions of, that was invaluable.
Learning by watching and doing with guidance.
Pretty much. It let them see effective techniques in action and adapt them to their own style, like having a guide for new territory.
Makes sense. What else?
Resource availability was huge. Having easy access to current textbooks, course materials, instructional videos, hands-on demos, basically, the tools they needed to prepare and teach effectively.
Having the right toolkit.
Yep. And formal professional development. Things like faculty orientation sessions were key for just understanding the expectations of the role. And clinical calibration meetings where instructors get together to discuss cases, share experiences, and kind of align their teaching and evaluation approaches, those were really helpful too.
Calibration.
Yeah.
Making sure everyone's sort of on the same page with standards.
Exactly. And many also found taking actual graduate-level courses in education helped build their teaching skills. And finally, something simple but important, self-directed learning.
Taking initiative themselves.
Yeah. The effective novices often took it upon themselves to read chapters before the students did, or review student feedback binders to see ongoing issues and progress, just being proactive.
So, it really sounds like a supportive infrastructure, mentoring, resources, clear expectations. It's just as critical for the instructors as it is for the students they're teaching.
Absolutely. You have to nurture the teachers so they can effectively nurture the learners.
Okay, that makes perfect sense. Nurturing the teachers.
And speaking of support and the environment, how does the actual system of evaluating students fit into all this? How does that impact an instructor's effectiveness and the whole learning atmosphere?
Oh, it's huge.
It seems like the evaluation method could either really reinforce all these good practices we've talked about or totally undermine them.
That's a perfect way to put it. The evaluation system is absolutely linked to both how students learn and how effective instructors can be. There's another study, Cornegay and colleagues in 2021, that looked right at this. They studied the shift to what's called a competency-informed evaluation system in dental hygiene,
Competency informed. As opposed to what?
as opposed to typically daily numerical grades for every little thing.
Okay. I remember those days. Stressful. Exactly. That traditional system often caused students to focus almost entirely on the score they were getting. Sometimes, that focus on the grade could even come at the expense of thinking about comprehensive patient care or really deep learning.
Right, gaming the system instead of learning the skill.
Kind of. So this new competency-informed system, it shifted the focus squarely onto patient care and achieving specific learning outcomes, often using more of a pass-fail model for the daily stuff.
Pass-fail daily. Focus on overall competency. Interesting. How did that work out?
The results were pretty profound. The big insight, maybe counterintuitive, is that by taking away the constant pressure of daily grades,
Yeah.
it didn't just reduce student stress and anxiety, although it did that too. It actually unlocked their willingness to ask questions, even the dumb ones, to admit mistakes, to take risks.
Because they weren't terrified of tanking their grade with every move.
Exactly. Fear is just such an enemy of learning, especially when the stakes are high. So both students and faculty reported a noticeable increase in the quantity and the quality of feedback.
More feedback and better feedback.
Yeah, it became more specific, more comprehensive. It actually simplified the documentation for faculty and led to better, more meaningful end-of-session discussions about actual improvement, not just haggling over points.
That makes sense.
Students felt way more comfortable asking questions, creating that safer learning space we talked about. And guess what? That allowed them to provide better patient care because they weren't paralyzed by fear.
Wow. Better care is the ultimate goal.
Absolutely. It also boosted student morale, fostered more of a growth mindset, focusing on getting better rather than just comparing grades with peers.
Less competition, more collaboration.
Seemed like it. And it even improved faculty-student relationships, took away some of that adversarial pressure that grading can sometimes create, made it more collegial. Faculty also felt it improved their own objectivity, using clear checklists for competencies.
Sounds like a win all around. Were there any downsides or challenges?
Yeah, it wasn't perfect. A big ongoing need is for faculty calibration. Making sure all instructors are assessing those competencies consistently is still a challenge.
Keeping everyone aligned, yeah.
And faculty did note that the new forms, the new system, still involved a significant amount of paperwork and time. And, change is hard. Some faculty found it tough to really let go of that traditional daily grading habit.
Old habits die hard.
But overall, the shift demonstrated a really powerful positive impact on the whole learning dynamic.
So it really highlights that the evaluation system isn't just like a measurement tool at the end. It's an active part of the learning environment itself.
Absolutely. It shapes behavior, shapes attitudes.
And changing the system can actually enable instructors to be more effective and students to learn better. It's like this positive feedback loop.
Exactly. Systemic change enabling individual excellence.
Wow. Okay, so putting this all together, what does this deep dive mean for you listening out there?
Well, I think our conversation shows that being a highly effective clinical instructor, it's really not just about being technically brilliant.
Right. That's just the starting point.
Yeah. It's this complex blend, isn't it? Strong communication skills that build that psychological safety, proactively creating a collaborative team vibe using tools like huddles, recognizing and supporting the specific needs of new instructors, and crucially, using evaluation systems that genuinely prioritize learning and patient care above just getting a score.
The instructor role is just incredibly multifaceted.
And deeply impactful.
Yeah. We've really seen that the best instructors are the ones who are not only skilled practitioners themselves, but they're also master communicators, they're empathetic mentors, and they're even advocates for systems like evaluation systems or support structures that really nurture growth.
It's about empowering everyone involved in that clinical learning process, the student, the instructor, the whole team, to really achieve their best.
Empowering everyone. I like that. So here's a final thought to chew on. Consider how these principles we've talked about, effective instruction, communication, supportive systems, in a really demanding clinical setting, how might they apply in other areas of life?
Yeah. Anywhere high-stakes learning and collaboration happen.
Exactly.
Yeah.
Whether it's in your professional team at work, maybe a community project you're involved in, or shoot, even within your own family. What's one small communication adjustment, maybe inspired by TIMER or the idea of a quick huddle, that you could make today to foster a more effective learning environment for the people around you?